Hey everybody, welcome to the answer session of this week's Ask Dr. Dan. I hope you all had a great week, and thanks again for all the great questions. Again, this week we are talking about the Sonex carpal tunnel release. This is performed ultrasound guided and is done with the smallest incision and the fastest recovery of any carpal tunnel procedure. With that, let's get to the questions. So the first question is, when will my symptoms improve? So with carpal tunnel, it is a problem with the nerve. So nerves will tend to heal very slowly. So as far as the numbness and tingling, which is very common in carpal tunnel, that can take months, sometimes even up to a year to fully go away. And that's with any kind of carpal tunnel release, whether it's open, arthroscopic, or ultrasound guided. Also, if you've had carpal tunnel for a very long time that you decided to not treat right away, sometimes the numbness will not fully go away. One of the other things that people will get with carpal tunnel syndrome is pain. That will typically get better very fast. Sometimes even the second you release the tunnel, people feel much better because that pressure is relieved. The other thing that can happen if there's chronic carpal tunnel syndrome that's been going on for a long time is atrophy in the palm here, in the thenar muscles. If there's atrophy, unfortunately, that will typically stay. Those muscles will not grow back, and again, that's regardless of the way the carpal tunnel is performed. So depending on the symptoms, they all take a different amount of time, but the most common symptom, which is the numbness, may take months or even up to a year. The second question, great question. So why is this method better than open or arthroscopic? So like we talked about, doing it ultrasound guided allows us to do it through the smallest incision possible. So with open carpal tunnel, you're talking about a 2+ inch incision that actually goes through the palm of the hand. Our skin on the palm of our hand is very thick, so what will happen sometimes is you get a lot of scar tissue buildup. So even though you get rid of that ligament that's compressing the nerve, now that scar tissue starts compressing the nerve, and so your symptoms can sometimes be even worse, and it can sometimes take months for that scar tissue to soften up and actually get good pain relief. Also, a large open incision like that is a much higher incidence of things like infection. There's a much longer recovery to let the skin heal. The arthroscopic carpal tunnel, which is done through a camera, usually 2 small incisions, but still those incisions are still about 3 to 5 times larger than the incision for the ultrasound guided, the Sonex carpal tunnel. So still a much larger incision. Also, you can only see what's at the end of that camera, so you can't see the entire wrist, where with ultrasound you can scan up and down, and you can make sure where the nerve and the arteries and all that stuff are in the right spot, and that your knife is in the right place. So you just see much better with the ultrasound than you can with the camera. Because of that, there is a slightly larger risk with arthroscopic carpal tunnel of damaging one of the small nerves in the hand, so as compared to the Sonex. And again, with the Sonex, it is done in the office under local anesthesia, which is another huge advantage, and the recovery is just much quicker than any of the other methods. So the next question is, if it is such a good procedure, why don't more doctors do it? Well, the simple answer to that is, in order to be able to do this procedure properly, you have to be very good at ultrasound. You have to know your ultrasound anatomy, like the front of your hand, like the back of your hand, and you also have to be very good at doing ultrasound guided procedures. So you have to be able to see that knife inside the wrist very well. And not a lot of people have that amount of ultrasound training and are proficient with it. So that's why it's not really done by a lot of people. And that's why we were one of the first offices in the country that were chosen to do it, because of the amount of ultrasound and ultrasound guided procedures that we do. And the last question, so is there any reason that this procedure cannot be performed? So yeah, there is a small percentage of people where their anatomy just does not allow us to do this procedure. So there has to be a little bit of a separation of the artery and the nerve, and on some people there is really no separation. So So for those people, they have to do the open route typically, but that's usually less than about 2 to 3% of the people. What we normally do before we would decide to proceed with the ultrasound carpal tunnel is we have you come in and we would scan the wrist. So we would just check the anatomy, make sure that everything is good to have this procedure done. And like I said, that's 95 to 97% of the people are perfect candidates for this procedure. So that's all the questions for today. I hope you all have a great weekend. Don't forget to like all our social media. So on Facebook at Apex Center for Regenerative Medicine, on Instagram at RegenerateNJ, and on YouTube at Apex Center for Regenerative Medicine. On our YouTube page, you can go back and see all our Ask Dr. Dan videos, as well as other informative videos. And don't forget to subscribe to our page while you're there. So have a great weekend, and remember, don't operate, regenerate.